Hello, I'm Dr. Aiden O'Loughlin. I'm an academic interventional cardiologist. It's been my privilege for the last 20 years as an academic researcher to have the privilege to research the prediction of heart attacks. Heart attacks remain the #1 killer in our society for people from the age of 35, but they are a modern success story of medicine. So over the last 50 years, the heart attack death rates have dropped from 600 people per 100,000 per year to, in 2024 in Australia, less than 150 people per 100,000 per year. So we've seen a 75% reduction in death from heart attack over the last 50 years. That's been the main driver of the increase in life expectancy in Australia of, on average, 15 years over the same period. In 2024, we have a wonderful array of tools and treatments to both predict your risk of heart attack, to prevent your heart attack, and to intervene if and when necessary. And with the tools and technologies we have in 2024, we can effectively reduce your risk of heart attack to close to zero. And so I've put together a schedule that I think of as the HAPPI consultation, and the HAPPI acronym stands for Heart Attack Prediction, Prevention and Intervention. And this is a strategy where we use all the modern tools and technologies, and I use my personal passion for heart attack prediction, which I've had the privilege of developing over the last 2 decades, to essentially reduce your risk of future heart attack whilst you're willing to be compliant with the recommendations and therapies to essentially zero. Yeah, so the HAPPI Consult idea involves consultation, where we take a complete history, look at your lifestyle and your risk factors. There's blood tests, and there are more advanced testing. So depending on the patient and their profile, that may include tests such as an electrocardiogram, an echocardiogram, and or a CT coronary angiogram. So the CT coronary technology has been around now for about 15 years, but over that period of time we've seen dramatic improvements in the resolution of the CT scanners. And the current generation CT scanner, we can see not only calcium in the arteries, but we can see lipid-rich plaques, which are actually a much more dangerous form of coronary artery disease associated with heart attacks. And we're still waiting for the arrival in Sydney of the next quantum leap in CT scanning, which is photon counting CT scanning, which has a resolution of less than 200 microns, or 20% of a millimetre in resolution, which again will drive further reductions in heart attack death rates.